The beginning was scary. We knew there is a virus, possibly deadly virus, hoping that it's not going to come over here to UK, but it did.
It was quite sudden, in all honesty. I don't think we understood fully how much this was going to affect us at that time.
Some things were predictable, some things not so predictable. So I think we prepared as much as we could. And then obviously this pandemic hit, and then you're just managing situations day by day as best as you can.
I remember being in work on a Thursday and we had, I think, one COVID positive patient, and within that weekend we were pretty much full.
Being in infection control for almost 26 years, I think this is one of the pandemics that nobody expected. There are a lot of unknowns.
I felt scared for myself and scared for my family. Apart from my own personal concerns, I was concerned very much for the people that I work with and the people that volunteer in this hospital.
We're all humans, so it's a new thing. Even myself, everyone was a bit scared. We had to take on a workload that we didn't really know much about, so we had to top up our skills. It's like, I don't even know how to explain it. It's on-the-duty learning, so it's been very tough. Sometimes I don't know how we did it.
It was, I suppose, a confusing time. It was difficult for people to ascertain where the risk was, what the risk was, the quantum of the risk.
I was asked to shield because of my medical conditions. Although the shielding was meant to protect me, but I felt like I'm letting down my trust, I'm letting down my colleagues. Watching from a distance, it's not the same. I really felt low, I felt depressed at times. It was very difficult, but I'm so happy, I'm so proud of them.
The care and safety of our patients was priority. A lot of patients that we see don't have anyone except us, really. They needed us.
I mean, it's been unremittingly hard work for the staff. People have gone not just an extra mile, but, extra hundreds of miles. I don't think you can keep going at this pace indefinitely, and it has been physically difficult with the amount of work we've had to do, but emotionally tough as well. This is a real, tragedy for lots and lots of families right across the country.
The sadness, the exhaustion, the pace of how the wave was coming, and the numbers. And I say numbers, they're people. There were people, real patients with really sad stories coming in. That was really, really difficult.
There's nothing that I've done that comes anywhere close to comparing to the last 12 months. It was very unpleasant having to create additional mortuary spaces. We had less than 200 mortuary spaces in January last year. We've got nearly 500 now. Having those members of staff that, we're talking about guys that are, some of them straight off of a building site, and they had been plumbers building flats to come in to work in here where they're asked to go into an ITU. The fear that you could see in their eyes by just asking them to go into that ward was unreal. And it plays on you personally. It's really, really difficult.
There were a lot of people that were genuinely scared, especially in the first wave. So for me, the constant reminder, telling people what to do and trying to allay their anxieties. Some of them were really, really challenging, and we had some, roller coaster, questions that, sometimes you have no answers to because you don't have answers to everything. There were times that the stress, kick in, and you have to go back to the bathroom and cry and clean your face and come back to work. But I love my job. I love what I do, and I'm very passionate. And I think that is what keeps me, going.
So for me, it was incredibly challenging. There are certain personal things which transpired, which made things very difficult for me. And there I had my own healthcare issues which had to be tackled. This was the time when my patients needed me, my team needed me, and whilst the personal risks were there, on the balance I felt that this was the right thing to do.
Losing a member of staff, it was quite early in the pandemic as well. It was a real shock. It was a real shock to the system. As big a team as we are, you feel it.
That was the hardest. Dennis was a man of character. You don't have many of people like this. He was a proper decent guy. So unfortunately, when Dennis passed away, literally everybody who could, they came out of the departments, the places where they usually work, just to say farewell to Dennis on his first journey to mortuary. But it was really nice to see so many members of our team just standing there to say goodbye or walking behind him.
When Dennis passed away, the team were devastated. We all were. And we're just so used to seeing him really cheery around the department. So I think to lose him and to this, and in such a short space of time, it was absolutely devastating. And I think that'll be one of the things that we will continue to hate about this virus, and will continue to stay with the staff. I need a minute.
In one instance, I was in recovery and we had 4 patients die pretty instantly of COVID on ventilators. And although I'm trained and I can usually control it, there was nothing I could do. They died very, very fast. Throughout the pandemic, really, it was no visitors whatsoever. So these patients were dying just with us strangers holding their hands. They weren't able to have any relatives with them.
A young chap in his 40s who had 3 children, and his wife was expecting her 4th child, and he passed away in wave 1. And the nursing team stayed with this gentleman while he passed away and FaceTimed his wife while she was talking to him. And she said to nursing staff, he likes his hair stroking. When I talk to him, I stroke his hair. Please stroke his hair for him. So the nursing staff stroked his hair while his wife talked to him on FaceTime while he passed away.
It was scary, and it was quite overwhelming actually to see the amount of people who were unwell with it. Being community children's nurses, a few of our team members were brought into the hospital. So me personally, I came in and I helped with the staff screening service. It was using a totally different set of skills to what we're used to, and it was very much based on communication. Our team also, who continued to visit children in the community, they had to really adapt because obviously a lot of our patients were scared. We've got a lot of sick kids at home who have complex needs, and they didn't really want us going into their houses as much. The separation from families, the unknown. People struggled a lot, especially with their mental health. There was a lot of support that Croydon put in for staff members, and that was brilliant. But I do think that will have sort of like a lasting, ongoing effect, and there is more work to be done in that sort of sense.
Because of all the COVID experience and the things I've seen and gone through, I've now been diagnosed with PTSD. We've hit our wall, we're tired, we're drained, and it's affected our home life as well as our work life, as well as our mental health.
It would be untruthful for me to say that I didn't worry about it. I worried about it every single day. Every single day when I went home, I worried about myself and worried about taking infection home to my wife and my family. And that level of anxiety cannot be underestimated.
So I think student nurses have had a really difficult time through this, and you could say actually to have this sort of experience at the start of your career can only inspire you, enhance your determination and motivation to continue in a career in nursing. So it's been really clear in terms of how we support junior nursing staff at the start of their career in dealing with something so phenomenal and that so many senior people have never experienced, and I hope for them that they never experience anything like this for the rest of their careers.
We report to the chief nurse, and the chief nurse would text me at night and say, "Are you okay? We're really pleased you're with us." And those are the things that give you that boost and that little step.
I've seen my role in terms of listen, support those staff, thank them for all they've done, and ensure that they know that they made a valuable contribution.
This episode makes me feel like there's nothing I can't achieve, me and the team, and I'm really proud of them. They've made the impossible possible.
What Croydon does well is when there's a crisis, we come together as a family, and amazing things happen, and it was the same at this point in time.
What's kept me going throughout this whole last 10 months, I'd say, is the team. The team that I work with are absolutely amazing. I think they are the reason I stay in the job that I do. They are a key part of that. I think the fact that it's not just all doom and gloom. We're all in it together. We're all sharing the workload. We still have time to smile. All of that kind of just keeps me going at work. And I think without them, it would be a very difficult job. So if anything, if I want to thank anyone, it's definitely them. They are absolutely amazing.
I don't think I've ever been as proud as I am to work for the NHS. Being in the middle of it and seeing what our colleagues have had to do on a daily basis has been incredible. My respect for people has gone through the roof.
It's just so beautiful, caring and looking after people and saving lives.
Croydon's a very connected place, more connected than anywhere else I've worked in my nearly 30 years in the health service. Nearly 70% of our staff who work here also live in the borough, and that makes it feel a bit like we're treating each other.
This is our community, this is our neighbourhood, this is us really, to be fair. So apart from even having to care or being a nurse, we just still have to look out for one another, because obviously it could be me that need my neighbour next time. So this is like our community, this is us really. So we have to really support each other.
One of, I suppose, the positive challenges we faced were people looking to make donations. We took in circa 300 iPhones as a donation from an anonymous donor, and, very gratefully accepted. Wonderful.
There's lots of things that have come out of this that, we've done things better as a result of looking at things in a different way. And whilst you'd never want the positives to come from something so difficult, the fact that they have come, I think, is great, because it means that we can take from this, perhaps in different ways of working. And things like that have made, I think, a massive difference to what we've done in the pandemic, but what we'll do also going forward as an organisation.
Give Croydon a problem, Croydon fixes it. So Croydon came up with the Croydon Elective Centre, and this is a fantastic development. It's a hospital within a hospital. The benefit of that is that when we said we could return to elective operating, so if you need an operation, we can say that the operation can go ahead and actually ensure that patients get the care they need when they need it.
One of my best memories was joining colleagues from across the hospital in a guard of honour for our first patient that left intensive care after beating COVID. The feeling of elation and buzz it gave to all of us, I'll never forget. For 30 days, this patient was in intensive care, critically unwell. And as she left, walking past the guard of honour, I remember her saying, "Thank you, you've saved my life." I'm so proud of the compassion, the bravery and determination of all of our staff that meant that we're able to see her and so many others reunited with all of their families. For me, that makes everything that we've been through totally worthwhile. We were really excited in Croydon to be one of the first vaccine centres. We know the rates in Croydon have been incredibly high, so we were really proud that we were going to put ourselves on the map and be some of the first to start the vaccine.
At least we should really be grateful for all the wonderful, hard-working scientists out there that have actually come up with something.
It's a dream come true, because nobody is expecting that we will get a vaccine for COVID-19 very, very soon.
It's like a candle that's being lit when there was darkness. It's brought a lot of life. It's brought confidence, especially in me.
I'm hoping that it signifies a new beginning, a beginning that means that we're not staying inside, that we're not staying away from family, that we can start to enjoy ourselves again.
Amongst a lot of tired faces and a lot of tired people, there is positivity. We do feel as though 2021 will be a year that is seen more as a successful year.
As we go through this year, I hope that we can go back to what will be known as probably a new norm in society.
For me personally, look to the summer to have some annual leave and a proper holiday, and look to planning for winter next year with COVID, but in a very different way. I miss meeting up with friends and
and not having to worry about 6 people and bubbles and things like that. It would be lovely to have a world again where we can just decide to do something and do it.
I miss my family, and especially now where I became a father literally last month, and I want to show off my son to my mom. She became a grandmother, so for her it's brilliant, but she hasn't seen her grandson yet. So for me, this is what I'm looking forward, this is what I'm planning. I can't wait.
I want to fly to Zimbabwe to see my brother and family. I will take the first flight. Yes.
I am hopeful for the second half of 2021, but to have some semblance of normality.
I think that we'll continue to be a fantastic service that is offered in Croydon, and that we will support each other, and that we will keep going.